Hey guys, this is Vinay back again. We are at Medlinks with Dr. Gaurang Krishna, and today we're going to talk to him about PRP. I'll just go on with the questions. The first question would be, what exactly PRP is?
Okay. See, PRP is basically platelet-rich plasma. It's a concoction of growth factors, your own growth factors, right? So we take your blood, we extract growth factors from it, we activate them and inject it. So if hair loss is concerned, we give micro injections into the scalp, and which causes better hair growth. So basically, platelet-rich plasma is a concentrated solution of your own growth factors.
So you take the blood from your arm, and then you extract the platelets from it.
Yes, platelets, and then activate them, which release the growth factors. So we don't want the platelets release, we want the growth factor.
Okay.
It's growth factor rich solution. That's what.
And then you inject them in the scalp, the affected area. Okay. And how does this help or affect hair growth?
Okay. So PRP is it has growth factor, so it has regenerative properties.
Okay.
So when we inject it in the scalp, it restores the normal environment of that part of the scalp, of that part of the skin. So the hair which are thinning may get energized, may get thicker. The hair which are in the dying phase, we call it the telogen phase, may quickly re-enter the anagen phase. So the hair shedding may go down.
Okay. And
because it's a dense source of growth factors, it ultimately gives a bounce to your hair. That's what it's doing.
Is it the next best thing to hair transplant? Would you say that?
See, they don't compete each other. They are not competitors, these two treatments. They act in a symbiotic way, right? So when the problem is baldness, it's hair transplant. When the problem is hair thinning, hair loss, it's PRP. So with other medical treatments.
As long as your scalp has roots there, and even if thin strand is there,
yes,
the PRP can help it grow.
Yes.
But if the roots are gone, like in the male pattern baldness, the one that I suffered,
yes,
I didn't have any other choice.
Yes. Then it would be only a transplant.
So after a transplant, this is the best option. When you talk about laser combs or other medicines,
no. So now let's talk about hair thinning, hair loss. So PRP is not the number one treatment for hair loss.
After hair transplant.
Hair transplants for baldness.
Yes.
So that's a separate group.
Of course.
And then there are treatments for hair loss.
Okay.
You are losing hair, you are not yet got bald, but you want to prevent yourself from getting bald. That's where PRP comes in. So first are medical treatments. So there's a tablet, a prescription medicine and a prescription lotion. They hold the center stage, and then laser and PRP and sometimes physiotherapy is done for an add-on. So out of these add-ons, in my opinion, PRP is most effective.
And who is the best candidate for PRP and who isn't?
Okay. So again, if anybody has hair loss problem, hair thinning problem, is shedding a lot, should benefit with PRP. PRP is not a sure shot thing, it's not a 100% successful thing, but yes, there is a reasonable satisfaction rate in more than 80% of our patients in our practice. So anybody who has hair issues is a candidate for PRP, but there is a cost involved in it.
Okay.
Significant cost involved in it. So we don't offer PRP as the first line solution.
Okay.
We offer PRP as a second line solution if standard medication are not working, or if for the patient, or let's say the patient doesn't have too much financial constraints, wants to try the best possible treatment, is interested in faster results, then we offer him or her PRP as a first line treatment along with medical treatment.
And how soon can one see results from PRP?
That's a good question. So there are two things when hair loss is concerned. One is hair shedding, you're losing hair, and one is hair thinning, you have thin hair. So we have two aims, two goals. So one is to prevent further hair loss, further shedding. We have to reduce the shedding. So that normally happens within a month or 6 weeks.
Okay.
So when we do a PRP session, in 4 to 6 weeks, the patients report a reduction in hair fall.
Okay.
So that's one thing. When we see volume, we want, the second goal is to thicken the existing hair. Then it is about 3 to 4 months when we start seeing an effect.
With one
PRP session.
And how often should or can one get PRP?
So there is no standard protocol for it as yet, because PRP is still a new procedure, is being done for the last 4 or 5 years only. So everybody uses his own protocol. What I use is on day 0, that's the first session, then after a month, and then after 3 months. So my intensive treatment for PRP is 3 sessions within 3 months. Day 0, after 1 month, and after 3 months. I have chosen this because there is a thought that a single PRP may not always work. It can be a cumulative effect. So for this cumulative effect, we give our second session after 1 month. Even if we have not seen any response, we still go ahead and give the second session after 1 month, and then we wait for 3 months. 3 months, why? Because usually the hair cycle is of 3 months.
Yes.
The hair completes its cycle normally in 3 months. So that's the time when we should start seeing some improvement. So that's why the third session is at 3 months. After that, I give it either once in a year or twice in a year, depending on patient to patient, not more frequently than that.
Is PRP performed differently center to center, clinic to clinic, or is it a simple process and every place you go it will be performed in a similar way? So a patient can actually look for a place who's doing it maybe a little cheaper, or is there a real difference to it?
That's a very, very nice question, and that's very relevant in today's medical industry. See, PRP is, though it's a standard procedure, but there are still, the principles are not very clear. How to make PRP, which machine to use for making PRP, what should be the temperature of blood before you start making PRP, what should be the temperature of the machine. So there are many centers which do not know these things at all. They don't have the concept, because many centers are not doctor driven, technicians or other people do. And hygiene is very important, very important. There are centers who are not doing it in a hygienic way because it's blood, it's re-injected in your system. So hygiene has to be very, very important. Some centers outsource their PRP. They send it to a lab. So your sample goes out of the center, don't know what's happening there, it's coming back on the road. So it's very important to choose the center correctly. So it's not same everywhere. Like a hair transplant, which sounds like just hair transplant. How can it be different? It all comes down to the skill of the surgeon. Similarly, PRP is also the protocol of the center. So it took us 1.5 years to master the art of making PRP.
Okay.
What should be the parameters of the machine? Which machine, first of all? What should be the parameters of the machine? How to handle PRP before it is made, how to handle the blood before PRP is made, how to handle PRP after it is made, how to activate it, whether to activate it or not to activate it, everything makes a difference. So now the good centers know that, okay, these are the settings, these are the parameters which you should use, this is the machine which you should use. Many patients don't know, many people who are performing PRP don't know that temperature is very important. It's very important that you bring down, we are warm blooded, so our blood is warm.
Yeah.
It's very important to bring down blood to room temperature before you start making PRP, otherwise your platelets will get damaged, your growth factors will get damaged. So that is one thing that most of the people do not know.
So it could be possible that doctors are actually trying to make PRP and they're injecting nothing.
They're injecting nothing, they're just injecting plasma.
Yeah.
Or they're injecting damaged growth factors, which is not going to make any difference.
So you pay for the procedure, you get the pain and you get no result.
You get no result. And the unfortunate thing is that the person who is doing PRP is not aware that he is doing it wrong.
Yeah.
He is doing it with all the sincere intentions, but sometimes these things do happen. And again, normally people do not use a refrigerated machine.
Okay.
It has to be temperature controlled. The temperature has to be 16 to 18 degrees Celsius. If it is more, if it is less, the PRP won't be perfect. So there are many things which play a role in giving the results of PRP and safety of PRP. And again, how less painful you make the procedure is also an art and a science. So yes, it differs from center to center.
So it's best to choose a good center for it.
You have to do your research.
Yeah.
Don't be shy in doing research.
Yes.
Don't be shy in asking questions to the doctor or whoever is performing.
Especially take reviews. I always
And
recommend take reviews for whatever procedure you're going. Take reviews. Ask for references. Try to talk to them. I think that's the best and easiest way. Does it have any side effects?
Not really. Against your own blood product.
Yeah.
They're not really adding too much, chemicals, so it's very, very safe because your own blood product is going into your skin.
But we do add something.
We use calcium chloride as an activator, which is a very, very innocuous thing. So no side effect. The only two side effects are, one, it burns a hole in your pocket. So that's the one. And yes, it's a slightly painful procedure. So we do it under local anesthesia. So yes, some tenderness can be there. So that's, if you can call it such side effect.
Basically, you end up getting around 50-60 injections on your head. So that's the only
thing. No medical side effects.
No side effects. Because people do not care about short-term side effects or even pain or anything.
Pain and swelling is okay.
Yeah.
But it's not like a person can get a headache for a long time or infection or whatever. So no medical side effects.
Okay. Okay. And for a person like me who just got the hair transplant, I mean, what all things will PRP help in?
So now PRP, after hair transplant, PRP is not mandatory, but we do give PRP to all our patients, and we insist on to our patients that do take PRP with us, because as I told you, it's growth factors. So it will promote growth, faster growth, more robust growth.
Okay.
So when we are looking at it from a hair transplant point of view, we are looking at faster results. So the new hair will come slightly faster and better. They will be thicker than usual. So we have some studies done in our center in which we have reasons to believe that when we add PRP after a hair transplant, results are slightly better.
If a person gets PRP done, like for example, I get a few PRP done, maybe 1, 2 or 3, and then I get good results. So I get good results and I see them for a year, and you suggesting that after a year you should repeat the process. So if we do not repeat the process, someone does not want to repeat the process, will they lose the good hair that they've got? Will they lose it? They will have to continue?
Yes. So transplanted hair will not go.
Of course.
Right? But the hair thinning is an ongoing, a dynamic process. There is no stopping the hair thinning process. So any treatment, be it medicines, PRP or laser, has to go on. Doesn't matter you have taken 10 sessions or 20 sessions. The moment you stop taking it, that the process is there, which is happening. You will.
So there is no such thing in the industry which can stop hair loss. Like you get it done one time. Of course, apart from hair transplant, there is no such thing. No medicines, nothing that you can get it done once and then you're good to go for life.
Unfortunately, not. There is no cure for baldness.
You just have to keep either you're taking medicines, you're using the laser comb, you're getting PRP done. You have to keep doing it for the rest of your life to maintain your hair, to enjoy your hair.
Till the time better treatments come, genetic therapy, the gene gets removed, but that's going to take time.
Okay, so that's about it for PRP. If you guys have any questions, please put them down below in the comments. And as always, thanks a lot for watching. Hey guys, thanks a lot for watching that video. If that video helped you at all, please hit the like button. If you have any questions, put them down below in the comments. To watch more videos, please click right over here, and for upcoming videos, subscribe to my channel right here. Thanks.